Hello, my name is Nancy Cooper. I'm a registered dietitian here at Englewood Health, and today we're here to talk about nutrition. So why is nutrition counseling so important? Nutrition counseling is important for all oncology patients. For example, if your vitamin and mineral status, protein stores, and hydration are optimal, you will have a better response to treatment. Patients with head and neck cancers are more vulnerable to eating problems and should see a dietitian. Some nutrition research applies to all cancers, while other research is tailored towards specific types of cancers. How can good nutrition help you? Good nutrition can decrease risk of infection, increase strength and energy, preserve lean body mass, rebuild body tissue, improve your tolerance to treatment, help you recuperate faster after treatment, support your immune function, and enhance your overall well-being. What does a dietitian do? Well, a dietitian individualizes care for your specific needs. A dietitian helps with immediate symptoms or discusses prevention of recurrence. A dietitian makes concrete suggestions about how to achieve your goals. What should you be eating during chemotherapy or radiation? Well, you should be focusing on protein and hydration, fruits and vegetables, whole grains, and healthy fat. Specific recommendations will vary based on where you are in your treatment, what your goals are, and what your nutrition status is. How can you manage side effects? For fatigue, try small, frequent meals and nutrient-dense foods for energy. For nausea, eat a low-fat, bland diet of cold foods and consider some ginger and peppermint products. If you're struggling with constipation, increase your fiber, stay hydrated, try warm liquids, including prune juice. With diarrhea, I suggest a brat diet, which is bananas, white rice, applesauce, and toast, and avoid dairy. If you're experiencing weight loss, eat and drink plenty of calorie-dense foods and liquids. Throughout treatment, we ask you to practice good hygiene and wash your food and hands thoroughly during food preparation. Do I need to avoid sugar during treatment? We know that a lot of sugar can depress the immune system, and we want your nutrition to be optimal and make sure that sugary treats do not crowd out more nutritious foods. Enjoying a treat occasionally is generally not a problem. We hope to meet with you to discuss your individual nutrition needs and answer any questions you may have. You can reach us at 201-894-3867, which is our office number, or you can email us.
Hi, I'm Dr. Vinithya Dave. I'm the Director of Palliative Medicine here at Englewood Health. So what is palliative care? We're a team of specialists that work with your doctors to address your symptoms and stress of serious illness and curative care. Our team includes board-certified physicians, nurse practitioners, and nurses that work alongside pastoral care, social services, child life specialists, and other multidisciplinary teams here. We provide relief from symptoms and the stress from serious illness. We will also help treat physical, emotional, spiritual, and psychosocial well-being. Our goal is to improve your quality of life and support you and your family through this journey. Many times people ask, when should I see a palliative care provider? Palliative care can begin at the time of diagnosis and can be seen throughout all the phases of your treatment and follow-up. The palliative team will help you find coping mechanisms following a cancer diagnosis and during the treatment. In addition, they'll help address emotional responses to the cancer diagnosis. Whether your faith is your anchor or feels like it has abandoned you, spiritual issues are addressed while honoring your beliefs, culture, and traditions. The team will help control any symptoms which occur, including pain, fatigue, loss of appetite, nausea, shortness of breath, or changes in your sleep behavior, and we can help out with anything else that you may be running into. Many times people ask, how will my palliative care team work with my oncologist and my other doctors? The palliative team works closely with your oncologist and in partnership with your other physicians to provide expert symptom management, an extra layer of support for you and your family, and to help facilitate communications about goals of care, your beliefs, and your wishes for your treatment plan. So after hearing all of this, you may be wondering how you can have a palliative consultation. ask any of your providers, or call for an appointment. We can see you in the hospital, the infusion center, or come over to your oncologist's office. For more information, please don't hesitate to call us. We're here to help you.
Hi, I'm Kathy Verhulst, Manager of Patient Navigation. I'm talking to you today about services that are available to help you and your family as you move through your care. There's a lot that's been developed to help people and their families who are moving through a cancer diagnosis, and what I want to give you is an overview of some of the services in the community as well as right here at Englewood Health so that you have what you need at your fingertips. The American Cancer Society is available 24 hours a day with a live person to take your questions and provide information on cancer as well as connection to services including transportation, wigs, and more. There's also Cancer Care of New Jersey, which provides free professional counseling, financial assistance, and more, as well as the Cancer Hope Network, which connects you to people who have walked in your shoes and are available to help you. Right here at Englewood Health, we're pleased to offer the Graft Center for Integrative Medicine. At the Graft Center, you can schedule an appointment for acupuncture, holistic nutrition, Reiki therapy, yoga, meditation classes, and medical consultation. Services are also open to family members and the public. Also at Englewood Health, we have a child life specialist who can help you address the needs of children of all ages when a loved one is going through medical care. There are several options available when hair loss is a side effect of your treatment. A cancer diagnosis affects many areas of life, including your job. Cancer and Careers is one resource. For those financially affected by cancer, the Patient Advocate Foundation is a clearinghouse of grants available. Getting to your treatment is key, and luckily there are several options to help. You may be eligible for home-delivered meals. A wonderful resource for women going through cancer treatment is Mary's Place by the Sea. Mary's Place offers a respite stay to rejuvenate. Support groups. Many people find it helpful to connect with others. For a listing of support groups available at Englewood Health, visit our website, englewoodhealth.org. Support groups are also offered through our community partners, including Cancer Care and the Cancer Support Community. This is an overview of some of the resources that are available. There are more, and we want to connect you to them. Feel free to contact the Patient Navigation Department. We want you to do well, and we are available to help ongoing with any information, services, or support as you go through your care at Englewood Health.
Hello, my name is Tina DeMarco. I'm the director of the Infusion Center at Englewood Health. I'd like to welcome you here today and take you for a brief tour as well as give you some information about our center. Patients come to the Infusion Center for chemotherapy, intravenous medications or fluids, injections, procedures, or blood product administration. We are open Monday through Friday from 7 a.m. to 7 p.m., on Saturdays from 7 a.m. to 5 p.m., and on Sundays on call. One of our patient care technicians will escort you to one of our 24 private rooms. Let me tell you about some additional features. We have on-site laboratory services, an on-site pharmacy, which expedites your treatment preparation, a separate visitor and waiting area for registration, scheduling, and insurance authorization, a pantry area with refreshments, a resource room, and art therapy room. Let me tell you a little about our clinical staff. We have oncology-trained pharmacists that verify and prepare all your medications. We have licensed registered nurses to provide education and administer the medications. We have nurse practitioners to provide symptom management and respond to any emergency. We promise to offer exceptional and professional care and act in your best interest at all times. This is one of our 2 care team stations. Our nurses are always available to answer your questions or address your concerns. So people often ask, where do I go for treatment? The Infusion Center is located on the first floor of the Berry Building. You will check in at the reception desk, where you will be registered and receive an identification band. All appointments for infusion are separate from doctor's appointments and must be made at the Infusion Center. Let me tell you what needs to happen before your treatment can begin. A visit with your doctor to review your condition the same day of treatment or several days prior. You'll have your vital signs checked, height and weight recorded, and blood drawn if needed. For an infusion, you'll be assigned to a nurse who will start an IV while waiting for your lab results, which may take up to 45 minutes. If you are having an injection only, you'll be taken to the injection room to receive your treatment. If you're coming for a blood transfusion, the blood bank will need additional time to type your blood and find a match. People often wonder how long the treatment will take. Your treatment can take anywhere from 10 minutes to 6 hours or more. Chemotherapy regimens often contain anywhere from 1 to 4 different types of medications. You may receive pre-medication to prevent side effects or extra IV fluids for hydration. These measures can add anywhere from 30 minutes to 4 hours to your total infusion time. Often people wonder if they're allowed to eat prior to and during their treatment. We ask that you try to eat a light meal prior to your treatment. A light lunch and snacks are provided at the Infusion Center for patients receiving treatment that will last more than 2 hours. You are also welcome to bring your own snacks. Guests may bring their own food or purchase from our cafeteria. You may ask what you should bring. Blankets and pillows are provided. We recommend that you dress in layers. If you have a port, you should wear shirts with a button down or zipper front. Many patients bring books, knitting, drawing to help pass the time. We recommend you have a visitor that can drive you home, especially after your first treatment. What if you need assistance during your treatment? You will be monitored for any side effects or unanticipated reactions. A call bell is provided and will be within reach at all times. Your TLC team is a great resource for questions and concerns about your treatment, nutrition, activity, what to expect, or any other concerns you may have. Communication with your care team is really important. Please keep us informed of any medication changes or supplements you are taking at home. At each visit, tell your nurse and doctor of any side effects you experience after treatment. Let us know if you need to visit any other healthcare or therapeutic providers, your dentist, massage therapist, or acupuncture. All of your current healthcare providers should be informed about your current treatment at Englewood Health. Always feel free to ask any staff member if you need help, or contact us on the main number if you have any additional questions. We can be reached at 201-894-3600. Thank you for entrusting your care to our team here at the Infusion Center of Englewood Health.
I'm Mia Gaines, the Supervisor of Radiation Oncology. What is radiation therapy? Radiation therapy is commonly used to treat many cancers. It works by damaging the DNA in the cells and destroys the cancer cell's ability to grow and multiply. Radiation can be given to alleviate pain or for curative intent. Radiation can be given externally, which is most common, as well as internally. Types of radiation treatments include external beam therapy, which is similar to X-rays but is much stronger. The radiation is produced by a machine called a linear accelerator. The radiation beam enters the body, damages the cells, and then leaves the body. The effects of radiation stay with you, but the radiation is not in your body and you are not radioactive. Internal radiation treatments can be low dose rate, LDR, or high dose rate, HDR. The LDR treatments involve implanting a radioactive source or isotope, and these sources decay over time. If you are receiving LDR treatment, further instructions will be given to you regarding radiation safety and being around others. Your radiation oncology team. The radiation oncologist is a physician who prescribes your radiation treatments and oversees your care. Radiation therapists position you and deliver your radiation treatments. Radiation oncology nurses are registered nurses who work with the team for your overall care. Medical physicists and dosimetrists work with the radiation oncologist and use computer programs to create your treatment plan. Physicists also ensure all equipment is properly calibrated. When you come in for your daily appointments, we'll bring you into one of our treatment rooms. How many treatments will I receive? This is determined by your radiation oncologist and depends on what is being treated and the goal of your treatment. The number of treatments can range from 1 to 45. Will I be radioactive? Can I be around children? The only instance in which you would be radioactive is if you have a radioactive source injected or implanted into your body. If you are going to be radioactive, you will be given very specific instructions. However, most treatments are delivered via external beam therapy. How long do treatments take? Most treatment times are 15 minutes, and this allows for setup as well as administration of your treatment. I heard that I will receive tattoos. Is that true? Yes, in most cases you will receive a few tiny freckle-sized tattoos. They'll be used to align you. What appointment times do you offer? Our department is open Monday through Friday from 8 a.m. to 6 p.m. Treatments are given from 8 a.m. until 5:30 p.m., and times are based upon availability. What should I wear? Feel free to wear whatever you are comfortable in, as most patients will be required to change into a gown. There are many other particulars involved in receiving radiation therapy. Once you have a consultation and are set to begin treatments, we will set you up with a formal teaching appointment. Feel free to bring any questions you may have. We want you to know we're here for you. Any questions you have, anything you need, please don't hesitate to ask.